So, okay, we're just gonna do a quick tour of the room. All right. Okay. It's a quick photo of our IDs here. Okay. Let me just wash my hands really quick before I start. Before we begin. Right. Hello, my name is Seward Paul. I'm a psych nurse practitioner. I'm going to be performing a head, neck, skin, hair, and nail exam. My patient Sonny here, so kind of let me work with him. Okay. If at any time you feel any discomfort, just let me know. Okay. So we're gonna get started. I'm just gonna start with the head and neck. We'll go from the eyes, ears, nose, and mouth, and then we'll go ahead and do the skin, hair, and nails. Okay. All right. So just to start the head and neck, first thing I'm gonna do is just I'm gonna check, just do an overall inspection. Just by looking at him. What I'm looking for is just symmetry, and just to make sure that the facial structures are symmetrical. I don't see any ptosis of an eyelid or drooping of the mouth. Everything looks good. All right, the nose is midline. The neck is straight. There's no deviation in the trachea, and it's midline. Okay, so the next thing I will do is I'm gonna go ahead and palpate the head. So just gonna start putting some pressure. Just let me know if you feel any pain, okay? And while I'm doing this, I'm just checking for any lumps or bumps, any soft spots or unusual areas, okay? Since I'm here, I'm just gonna go look at the hair since I'm already here. And the hair is soft, it's evenly distributed. No male pattern baldness that I spot here. All right, okay. So the hair looks good. All right, okay. So what I'm gonna do now is I'm gonna palpate the temporal artery. All right, and I feel the temporal artery. Then I'm gonna come down to the temporal mandibular junction. I'm gonna have you open and close your mouth for me, Sonny. Close it. Checking for popping or crepitus, which is happening in the TMJ right now, and the temporomandibular syndrome, usually, but I don't see any popping or crepitus. Okay, then I'm going to go down to the mandible. I don't see any problems with the joint here. Okay, so the next thing I'm going to do is we'll focus on the eyes. So the eyes are symmetrical. I'm just going to inspect. Looking at the sclera of the eye, and it's white. There's no signs of jaundice or blood vessels or any problems there. I'm going to open the eye a little bit and pull it down. The conjunctiva is good. It's pink. It's properly pink. It looks healthy. Okay. All right. So the next thing we'll do is check his pupillary responses and make sure that they're round, reactive to light and accommodation, and we'll check his reflexes. So I'm gonna grab my pen light here. So I'm gonna check my light, make sure it's not too bright for Sonny here. Okay. For this, I just need you to look straight at me. Okay. Pupils first. Don't move your eyelid. Just make sure that they're reacting and constricting. There we go. On that side. Good constriction reacted. Now I'm gonna check his red reflex. Make sure he has the right reflex, and I'm gonna check the blood vessels in the optic disc. Okay, so let me come over here. I'm just gonna get a little close here. Look for the red reflex here. I'm coming in. I see the blood vessels. I see the optic disc. Okay. You have a good red reflex. Same thing on the other side. All right. Perfect. Okay. All right. The red reflex is there. There's the optic disc. So next, I'm gonna check the extraocular eye functions. Okay. And the 6 cardinal views. But first, I'm gonna check the peripheral vision. So I'm gonna stand a little close here, and you tell me when you see my fingers. Okay.
I see them.
Okay. Another side as well.
I see them.
Okay, good. Okay. Now I'm gonna stand back. I want you to follow your eyes with my fingers. Don't move your head, okay? All right. So come over to this side, then up, down, midline, back over, up, down. One more time, up, down. I want to have you follow my finger from near far vision. For near far vision, which you pupils should constrict and dilate as I move my fingers back and forth. All right, I see it constricting and dilating. Okay, that's it for the eyes. Next thing I'm going to do is look at the ears, and then I'm going to inspect it now. The ears are symmetrical, even on both sides. I'm going to go ahead and just kind of palpate. All right, do the tug test. Any pain when I pull on the back of the ear here?
No.
All right, and this side as well?
No.
Okay, and I'll conduct the whisper test. I'm just gonna just close off the ear and whisper something off, and you tell me what I say. Okay? 1, 2, 3.
1, 2, 3.
A, B, C.
A, B, C.
Okay, good. All right. So we just did the whisper test, and next thing I'm gonna do, I'm gonna use my otoscope, and I'm just gonna take a look at his ear and check his tympanic membrane. Alright. Okay. So just gonna pull up on the earpiece. Let me know if you feel any pain. Pull up, back. And I'm just looking inside there. And the tympanic membrane is nice and shiny, nice and healthy. No signs of inflammation or perforation. All right, let me check the other side here. Tympanic membrane looks good. No signs of inflammation or irritation. Okay, good. So the last test I'll do is the Weber and Ryan test. I'm going to use my tuning fork. I'm going to place it on top of your head. You just let me know if it's if you hear it equally on the middle or the right or the left, okay? Hear it?
In the middle.
Okay, that's good. All right. And you tell me which position is louder, A or B, okay?
A. A.
Okay. Let me do it on the other side now. Which is an A or B is louder?
A.
Okay, that's good. All right. So that's a good Weber and Ryan test, which test is for air conduction versus bone conduction. Air conduction should always be louder than the bone conduction, so which is a good sign that he has good ear function. Okay. All right. That's perfect. Okay. So we're gonna just focus now on the nose. All right. I'm gonna check the nose. I'm just inspecting the nose now. Okay. I'm just looking for if it's midline, if there's no deviation to the side. I don't see any problems with the skin surrounding the nose. I don't see any rashes or perioral dermatitis or anything like that. Okay, we're gonna go ahead and just use our otoscope just to look at the inside of the eye. If you can just pull your head back, I'm just gonna kindly gently pull your nose back. Alright. I'm not seeing any inflammation, no polyps, any deviated septum. Gotta check both sides. Alright. No nasal discharge notice. No deviated septum. Okay. That's the nose. So next I'm just gonna check his mouth. I'm just gonna inspect the outside of the mouth. The skin looks good. There's no cracks, no bleeding, no irritation. I'm just gonna put some gloves on so I can go inside the mouth and just check the gums and the buccal mucosa. You okay, Sonny?
Yeah, man. Going bad.
All right. Okay, first thing I'm gonna have you do is just open your mouth for me. Stick out your tongue and say ah.
Ah.
I'm gonna press down a little bit here. Alright, and the mucosa looks good. I'm looking to the sides of the mouth of the full mucosa. Under the tongue for me. Under the tongue. I'm looking at the gum line. I don't see any redness, no bleeding, no signs of infection. Indentation looks good. Alright. Okay. Okay. Alright, good. Everything looks good there. So that's the head, the eyes, the ears, the nose, and the mouth. So the next thing I'm going to do is the neck. So again, I'm just going to inspect the neck straight. The trachea is midline. I'm just going to gently move the trachea from the side to side. No problems there. I'm going to go ahead and palpate his lymph nodes. I'll start in the preauricular area, then move to the postauricular, down to the cervical, and to the posterior cervical, okay? You know if you feel any pain. Submandibular to the mandible. You feel anything? To the anterior cervical, down to the posterior, to the cervical. I'm going to palpate the supraclavicle. I'm not feeling any hard lumps or bumps. Let's do this side. Okay, I'll just palpate the trachea. Alright, I'm going to turn you to the side just to check the thyroid. Alright. I'm just looking for any enlargements. I didn't see any signs of a goiter. Okay, can you swallow for me, Sonny? Okay, that's good. All right, so the next looks good. So next thing I'm gonna do is just gonna do a general skin assessment. So can you take your shirt off for me, Sonny? Okay, I'll just start with inspection, just looking at the overall color and the distribution of the skin. Everything looks even. There's no red patches or rashes. No darker pigmentation, even pigmentation of the skin. Okay. Alright. Alright. Alright, I'm just gonna check the temperature of his skin. Alright. The skin is warm and dry.